Hi, this is Alfred Brock, and today we're going to be listening and reading about, if you want to read about it, it'll be down in the remarks below, some information from the National Institute on Drug Abuse about cocaine. So let's learn a little bit about cocaine. So a brief description first of all. Cocaine is a powerfully addictive stimulant drug made from the leaves of the coca plant, which is native to South America. And although healthcare providers can use it for valid medical reasons, such as local anesthesia for some surgeries, cocaine is an illegal drug. As a street drug, cocaine looks like a fine white crystal powder. Street dealers often mix it with things like cornstarch, talcum powder, or flour to increase their profits. They may also mix it with other drugs, such as the stimulant amphetamine. Let's take a look at the drug facts. So what is cocaine? We've already learned that it is a powerful, addictive stimulant drug. Popular nicknames for cocaine include blow, coke, crack, rock, and snow. Now, how do people use cocaine? People snort cocaine powder through the nose or they rub it into their gums. Others dissolve the powder in water and inject it into the bloodstream. Some people inject a combination of cocaine and heroin called a speedball. And this has been in the news a long time ago. A comedian by the name of John Belushi died from taking speedballs, and a lot of people die from it and can be damaged physically from it. Another popular method of use is to smoke cocaine that has been processed to make a rock crystal, also called freebase cocaine. The crystal is heated to produce vapors that are inhaled into the lungs, and this form of cocaine is called crack, which refers to the crackling sound of the rock as it's heated. People who use cocaine often take it in binges, taking the drug repeatedly within a short time or at increasingly higher doses to maintain their high. Now, how does cocaine affect the brain? Cocaine increases levels of the natural chemical messenger dopamine in brain circuits controlling pleasure and movement. Normally, the brain releases dopamine in these circuits in response to potential rewards like the smell of good food. It then recycles back into the cell that released it, shutting off the signal between nerve cells. Cocaine prevents dopamine from recycling, causes excessive amounts to build up between nerve cells, and this flood of dopamine ultimately disrupts normal brain communication and causes cocaine's high. Pretty much the brain is numb, right? Now the short-term health effects of cocaine include extreme happiness and energy, mental alertness, hypersensitivity to sight, sound, and touch, irritability, paranoia, extreme and unreasonable distrust of others. Now, some people find that cocaine helps them perform simple physical and mental tasks more quickly, although others experience the opposite effect. Large amounts of cocaine can lead to bizarre, unpredictable, and violent behavior. Cocaine's effects appear almost immediately and disappear within a few minutes to an hour. How long the effects last and how intense they are depend on the method of use. Injecting or smoking cocaine produces a quicker and stronger but shorter lasting high than snorting. The high from snorting cocaine may last 15 to 30 minutes. The high from smoking may last from 5 to 10 minutes. Now, what are the other health effects? That's not very long, is it? Give up your life for a few minutes of whatever. Now, what are the other health effects of cocaine use? Other health effects of cocaine use include constricted blood vessels, dilated pupils, nausea, raised body temperature and blood temperature, faster heartbeat, tremors, muscle twitches, restlessness. The long-term effects of it depend on the method of use and include the following. With snorting, there's a loss of sense of smell, nosebleeds, frequent runny nose, and problems with swallowing. Consuming it by the mouth, severe bowel decay from reduced blood flow. Starts eating your insides out. Needle injection has a higher risk for contracting HIV, AIDS, right? Hepatitis C, and other bloodborne diseases. However, even people involved with non-needle cocaine place themselves at a risk for HIV because cocaine impairs judgment, which can lead to risky sexual behavior with infected partners. Other long-term effects of cocaine use include being malnourished because cocaine decreases appetite, and movement disorders, including Parkinson's disease, may often occur after many years of use. In addition, people report irritability and restlessness resulting from cocaine binges, and also some experience severe paranoia in which they lose touch with reality and have auditory hallucinations where they hear noises that aren't real. Now, studies have shown that cocaine use speeds up HIV infection. According to research, cocaine impairs immune cell function and promotes the reproduction of the HIV virus. Research also suggests that people who are infected with HIV and use cocaine and are infected with HIV may be it also, or who are infected with HIV and use cocaine, maybe it also have increased their risk for co-infection from contracting hepatitis C, a virus that affects the liver, even if they do not inject drugs. Now, there's more information for you to read about at the bottom of this video. You just click on the link, it'll take you to additional information. Now, can a person overdose on cocaine? Yes, a person can overdose on cocaine. That's true. An overdose occurs when the person uses too much of a drug and has a toxic reaction that results in serious harmful symptoms or death. An overdose can be intentional or unintentional. Death from overdose can occur on the first use of cocaine or unexpectedly thereafter. Many people who use cocaine also drink alcohol at the same time, which is particularly risky and can lead to overdose. Others mix cocaine with heroin, another dangerous and deadly combination. Some of the most frequent and severe health consequences leading to overdose involve the heart and blood vessels, including irregular heart rhythm and heart attacks, and the nerves, including seizures and strokes. Now, how can a cocaine overdose be treated? Now, because cocaine overdose often leads to a heart attack, stroke, or seizure, first responders and emergency room doctors try to treat the overdose by treating these conditions with the intent of 1, restoring blood flow to the heart from a heart attack, restoring oxygen-rich blood supply to the affected part of the brain in a stroke, or stopping the seizure. How does cocaine use lead to addiction? As with other drugs, repeated use of cocaine can cause long-term changes in the brain's reward circuit and other brain systems, which may lead to addiction. The reward circuit eventually adapts to the excess dopamine brought on by the drug, and as a result, people can take stronger and more frequent doses to achieve the same high. They need to take stronger and more frequent doses to achieve what they perceive to be the same high and feel relief from initial withdrawal. And withdrawal symptoms include depression, fatigue, increased appetite, unpleasant dreams and insomnia, and slowed thinking. Now, how can people get treatment for cocaine addiction? Behavioral therapy may be used to treat cocaine addiction, and examples include cognitive behavioral therapy, contingency management, and motivational incentives, providing rewards to patients who remain substance-free, therapeutic communities, drug-free residences in which people in recovery from substance use disorders help each other to understand and change their behavior. While no government-approved medicines are currently available to treat cocaine addiction, researchers are testing some treatments, including disulfiram, which is used to treat alcoholism, modafinil, which is used to treat narcolepsy, a disorder characterized by uncontrollable episodes of deep sleep, and lorcaserin, which is used to treat obesity. Now, points to remember for what we just went through. Cocaine is a powerfully addictive stimulant drug made from the leaves of the coca plant native to South America. Street dealers often mix it with things like cornstarch, talcum powder, or flour to increase profits. They may also mix it with other drugs, such as the stimulant amphetamine. People snort cocaine powder through the nose or rub it into their gums. Others dissolve it in water and inject it, or inject a combination of cocaine and heroin called a speedball. Another popular method of use is to smoke crack cocaine. Cocaine increases levels of the natural chemical messenger dopamine in brain circuits controlling pleasure and movement. Its flood of dopamine ultimately disrupts normal brain communication and causes cocaine's high. Short-term effects include constricted blood vessels, nausea, faster heartbeat, extreme happiness and energy, irritability, and paranoia. Long-term effects include nosebleeds, severe bowel decay, eat your insides out, higher risk of contracting HIV, hepatitis C, and other bloodborne illnesses, malnourishment, restlessness, severe paranoia with auditory hallucinations,